Hi, my name is Michael Javillonar and I will show you how to do the proper procedure of Dr. ABC. Just always remember the acronym Dr. ABC. It is the initial procedure when providing first aid to the victim. D is for danger. At first, check the situation. Tignan mo muna ang paligid kung marami bang tao na nakikibalita sa pangyayari. At pag ganon, hindi nakakahinga ang victim ng maayos dahil walang masyadong pumapasok na hangin sa area. Second one is R. R for response. The second step to do is to check the vital signs and talk to the victim. And if he is unconscious, gently shake the shoulder and pinch the earlobe. Assess the level of response. You have to check there are four types of response. First is their alert. Second, their voice. The next one is if they feel pain. And the last one, if they are responsive.
Boss, narinig niyo ako? Yeah. Nararamdaman ba kayo? Nararamdaman niyo ba ako?
The third step of the procedure is letter A, for airway. Kapag ang biktima ay hindi nagre-response, tignan ang airway kung meron bang nakabara. Kapag ang victim ay hindi humihinga, open the airway and ilagay ang isang kamay sa kanyang noo at dahan-dahan iusog ang ulo paatras by lifting the chin. Tanggalin ang mga nakikitang mga nakaharang tulad ng mga nakabarang pagkain para makapasok ang hangin sa airway para sakaling mag-perform ng mouth-to-mouth. Pero bago gawin yon, kailangan ay ikaw ay dumaan sa pag-aaral kung paano ito i-perform. The fourth procedure is B for breathing. To check the respiration rate, if the victim is adult, it has to be 60 to 80 pulse rate in a minute. And if the victim is child, their pulse count in a minute must be 60 to 100. Checking the breathing of the victim, first, maintain to open the airway and place your ear over the victim's mouth and nose. Look at the victim's chest. If he is breathing, then listen and feel for breathing for 10 seconds. Count for 10 seconds must be 1001, 1002, 1000 and so on and so forth. And the last step of the procedure is letter C for circulation. Kapag wala kang nararamdaman sa victim na pulso, ibig sabihin ay wala na siyang heartbeat and there is no circulation. If the pulse is absent, commence chest compressions. If there is no sign of breathing and there is no pulse, administer CPR. The second video is based on how to do a CPR. You will only apply a CPR if the victim has no sign of breathing and there is no pulse. First, open the airway. Put your palm on the person's forehead and gently tilt the head back. In the other hand, gently lift the chin forward to open the airway. But please, always remember, always check the age of the victim because it will depends on it the amount of speed when you perform the abdominal thrust. Because adult and child heartbeat is not the same. The child heartbeat is more faster than the adult, and in the age of the victim depends on how many abdominal thrusts you will do. If the victim is adult, do 100 abdominal thrusts. And if the victim is infant or child, do 120 abdominal thrusts and slightly faster on what you
Are
did
you
in the
okay?
adult.
Are you okay? Pwede po patawag po ng 161? Tumawa na! Narinig niyo ba ako? Anong nangyari? Wow.